How does wheezing happen in asthma? Have you ever wondered why some people make a whistling sound when they breathe? This sound is known as wheezing, and it is often linked to asthma. Let's break down how this happens. Wheezing occurs when the airways in the lungs become narrowed and inflamed. This narrowing can also involve excess mucus, which makes it harder for air to flow freely. When air moves through these smaller breathing tubes, it does so at a higher speed, creating that distinct high-pitched sound we recognize as wheezing. The process starts with inflammation in the airway walls. This inflammation causes the walls to swell and become sensitive. During an asthma attack, the muscles around the airways tighten, a process called bronchoconstriction. Additionally, the lining of the airways may produce extra mucus. All these changes reduce the diameter of the airways, making it more difficult for air to pass through smoothly. As air is forced through these narrowed passages, the walls of the airways can vibrate or flutter, resulting in the wheezing sound. You will most often hear wheezing when a person exhales, as the airways naturally narrow during this phase. In milder cases, wheezing may only be present during exhalation, while more severe narrowing can lead to wheezing during both inhalation and exhalation. The intensity and pitch of the wheezing sound depend on how narrow the airways are. The sound is similar to a vibrating reed in a musical instrument, created by the oscillation of the nearly closed airway walls as air passes through. Wheezing is a key symptom for diagnosing asthma and assessing its severity. However, it is important to note that the presence or loudness of wheezing does not always indicate how severe the airway obstruction is. Medical evaluations often include lung function tests to measure airway narrowing more accurately. Managing wheezing in asthma typically involves medications that reduce inflammation, such as inhaled corticosteroids, and those that relax the airway muscles, known as bronchodilators. These medications help open the airways and reduce the wheezing sound. In summary, wheezing in asthma happens due to inflammation, muscle tightening, and mucus buildup that narrow the airways. This causes air to pass through with enough force to make the airway walls vibrate, producing the characteristic wheezing noise. Understanding this process can help in recognizing asthma symptoms and seeking appropriate treatment.